Now we will continue with the part 2 of the local anesthetics. As we have discussed about the part 1, so now we will move to the part 2. So now we move to the next slide. So in this slide we will discuss about the classification of local anesthetics. The local anesthetics can be classified into the following two groups. This classification of local anesthetics is based upon the structure of different local anesthetics. The local anesthetics can be divided into two types of groups. Number one is the esters and number two is the amides. In this slide we will discuss about the esters. The esters are basically those local anesthetics which have the structure of esters within their structure. The local anesthetics which have the ester within their structures are called the esters. The esters include the drugs. First of all, the cocaine, which was the first drug that was discovered in 1880, and then the procaine, which also has a ester structure in the ester structure in their composition. Then the methocaine, which is a synthetic local anesthetic, which was discovered later, and then the benzocaine, which also have a ester structure in their composition or its composition, and which was also discovered later, and it is also a synthetic drug. Among the esters, cocaine is basically the naturally occurring, whereas the procaine, the methocaine, and the benzocaine are synthetically discovered drugs or synthetically made drugs by different scientists in different periods of time. This was about the esters. In this you can see in this slide, you can see that this is a basic structure of ester. This is a basic structure of ester, and here the structure of cocaine is also given. You can see in the basic structure of ester there are two oxygen molecules that are bound to the carbon, and similarly in the cocaine you can see that there are two molecules of oxygen that are bound to the carbon. One is bound to the carbon via a double bond, whereas other is bound to the oxygen via single bond. The ester structure can be reflected within the structure of the cocaine. This means that cocaine has the basic ester structure within its structural composition. Therefore, cocaine is comes under the heading of esters in this slide. This was about the esters, and now we will move to the next slide to study the amides. In this slide we will discuss about the second group of local anesthetic, that is amides. As I have told you that this classification of local anesthetic is based upon the structures of different local anesthetics. Some of the local anesthetics are esters, while some are the amides. Those local anesthetics which have amide structure within their structure, within their basic structure, are called the amides. The amides include the lignocaine, which was the first amide that was discovered, and then the prilocaine, then the bupivacaine, then the mepivacaine, and then the tirocaine. So all these drugs are basically having amide structure in their basic structure or in their basic composition. Therefore, they are called amides. Among all these drugs, lignocaine was the first local anesthetic with amide structure, while all other drugs are the synthetic drugs that were later synthesized in laboratories chemically by the chemical processes. Uh, Now, the two structures that are given on the right side of this slide, the upper one is of is the basic amide structure, which includes an oxygen group and a nitrogen group attached to the carbon. The oxygen group is attached to the carbon by via a double bond, whereas the nitrogen group is attached to the carbon via a single bond. Now, this amide structure can be reflected within the lignocane structure. The lower structure on the right side is of the lignocane, and amide structure can be marriage structure can be seen within the basic structure of lignocane. So it is evident now from the structure of the lignocane that amide structure is present within its basic composition. Therefore, lignocane is amide in nature. These were the amides. These were the local anesthetics that are amides in structure, and they include the lignocane, the prilocane, bupivacaine, mepivacaine, and thiodocaine. The classification. This was about the classification of the local anesthetics. The local anesthetics are basically classified into two groups. Number one is the esters, and number two is the amides, and they should be learned by heart. So now we move to the next slide. Now in this slide we will discuss about the pharmacokinetics of the local anesthetics. The pharmacokinetics basically means that absorption, distribution, metabolism and excretion of the local anesthetics. First of all, we will talk about the route of drug administration of the local anesthetics. Most of the local anesthetics can be given through parenteral route, or by local application, or by enteral route, that is oral route. Now, one example of the local anesthetic that can be given by parenteral route, that is via the injection, is mepivacaine. Another local anesthetic that can be applied locally on the mucosa to produce its anesthetic effect is lignocaine. And one local anesthetic that can be given via oral route is thiodocaine. So this was about the route of drug administration of the local anesthetic. Now, the local anesthetic can also form acidic form salts. This form of the local anesthetics are more water soluble and more stable. This is due to the fact that when this acid form salts are injected into the tissues, then they disintegrate into the acidic form, acidic part, and the basic local anesthetic part. And the basic local anesthetic part then produces pronounced effects within the tissues in which they have been injected. The duration of action, most of the local anesthetics have a duration of action of 1.5 hours. Now, about the metabolism of the local anesthetics, most of the local anesthetics are metabolized by the liver enzymes. Now, as we know that we have two types of local anesthetics. Number one is the esters, and number two is the amides. The esters, which includes the cocaine, procaine, methocaine, and benzocaine, they are metabolized by the esterases. That are the enzymes that are present in the plasma in the liver, and after metabolism, they are excreted via the kidney. We will continue the pharmacokinetics in the next slide. So now we move. Now in this slide we will continue the pharmacokinetics of the local anesthetics. So far we have studied that the metabolism of local anesthetics of esters nature is carried out by the esterases that are present in the plasma as well as in the liver, and after metabolism they are excreted by the kidney. Now we will discuss about the amides, which includes the lignocaine, the prilocane, the bupivacaine, the mepivacaine, and thiodocaine. So the amides are also metabolized by the liver enzymes, which are called amidases. It means that esters and amides, local anesthetics, both are metabolized by the liver enzymes that are esterases and amidases. But in addition, the esters local anesthetics are also metabolized by the plasma esterases. So we come to know that the metabolism of the local anesthetics is carried out by the liver, whereas its excretion is carried out by the kidneys. So it is worth mentioning here that in liver failure patients, the dose of the local anesthetic should be adjusted, because if the patient is suffering from liver failure, so he will not be able to metabolize the local anesthetics properly, and the toxicity of the local anesthetic drugs can occur. So we must reduce the dose of the local anesthetics that is administered to a normal person in comparison to the person who is suffering from liver failure. As we know that the excretion of the local anesthetics occurs to the kidneys, so in the kidney failure patients, the dose of the drugs, local anesthetic drugs should also be adjusted, because if the kidneys are, if the patient is suffering from kidney failure, so he will not be able to excrete the drug from the body as effectively as a normal person. Therefore, the doses of the local anesthetic drugs should also be adjusted. So this was about about the pharmacokinetics of the local anesthetics, in which we have studied about the route of the drug administration, that is the IV route or the parenteral route, the enteral route, and also the local application of the local anesthetics. Then we have discussed about the duration of action. Then we have discussed about the metabolism of the drug, that how the local anesthetics are metabolized by the liver, and which enzymes are responsible for it. And then at the end we have discussed the excretion of the kidneys. So now we will move to the next slide. In this slide, we have a diagrammatic representation of the pharmacokinetics of the local anesthetics, which is described under the heading of uptake, that is the route of drug administration, the metabolism of the esters and amides, and then the excretion. You can see here that the uptake or the route of administration can be oral route, topical route, and injection form. So the drugs, the local anesthetic drugs, can be given by the parenteral route, the enteral route, and through the injection forms. Then the metabolism is basically carried out according to the type of the local anesthetics. The local anesthetics, as we know, that can be of two types, that is the esters and the amides. The esters are metabolized by the esterases that are present in the plasma of the blood, and also within the liver. So the esters local anesthetics, which include cocaine, procaine, amitocaine, and benzocaine, they are metabolized by the esterases that are present in the plasma and the liver. Now we come to the amides. The amides, which include the lignocaine, prilocaine, bupivacaine, mepivacaine, and thidocaine, they are metabolized by the amidases that are present in the liver. So overall, the metabolism of the local anesthetics is carried out by the liver enzymes, and also by the enzymes that are present in the blood. Then the excretion, you can see that the excretion is carried out by the liver. So this is a pictorial diagram which elaborates the pharmacokinetics of the local anesthetics, and it is an easy way to remember the pharmacokinetics, that is the absorption, distribution, metabolism, excretion of the local anesthetics. Now we move to the next. With this, we came to the conclusion of the part 3, of the part 2 of the local anesthetics, and now we will move to the next part 3 of the local anesthetics. So stay tuned for the part 3